to get started, Randy, why are we talking about pre-hospital blood? What gets you excited about it?
It's taking some of the hard-fought lessons we learned in the military and taking to the civilian world where people are dying of hemorrhage every single day. And we have a solution. We just need to get it implemented.
That makes a ton of sense. And, you know, with respect to its origin, which you said was in the military, are we talking about 10 years ago, 20 years ago, 30? When was pre-hospital blood? And, you know, further out in the field, when was that a thing in the military? And when did people start to appreciate the impact that it was having on soldiers' lives?
So the first vampire programs got rolled out in roughly 2014, and the vampire was taking the red cells and the plasma out on the aircraft to the point of injury. Its roots come back earlier from 2001, where we started looking at fresh whole blood as a tool to help offset some of the shortages of the component therapy.
So that was the soldier-to-soldier walking blood bank that was initiated to offset some of the supply issues?
Yeah, and that really had its origin stories at places like the Combat Support Hospital I was at in 2005, where one patient could easily blow through our supply we had on the shelves. And so we simply turned to other soldiers and volunteers, drew their blood, and immediately took it either to the ER or the OR and put it right back into a patient.
So as I've heard you tell this story before, I also know it wasn't just out of supply and convenience that continued and even grew, but because of a perceived impact that it was having, a positive impact on patient health. Just briefly describe what that impact was. What was it that you were seeing that was getting people excited?
We started seeing a decrease in mortality, increase in survivability as more fresh whole blood was being put as a resuscitative choice. It'd been 30 years since we had really looked at whole blood. We'd converted really on the civilian side using component therapy, took those practices into the military and realized, wait, when you don't have more component therapy to use, fresh whole blood is actually increasing survivability. So maybe we need to rethink what we're doing.
So as a kind of just trying to envision, you know, in that time when you were a nurse at a kind of a Role 3 hospital and you received a patient who had gotten blood maybe at Role 2, how did that presentation of that patient differ if they'd gotten a whole blood or even gotten component therapy versus not at all? What were you seeing just looking at that patient as the provider?
So a little less sick. Their shock indexes were lower, less tachycardic, higher blood pressures coming in, which we all know those are predictors of mortality.
Yeah, that's awesome. So then the military, I guess you and others in the military started seeing these results. The program began to expand. Did it just take off, or was it an uphill battle to then get more people using whole blood and make that a real program and structure the guidelines around that?
It was a bit of an uphill battle, I think, with any innovation and any change from current practice. But we had some great folks who were advocates, who pushed for it, who were seeing some of the results at the bedside, getting that feedback to the right folks that we needed to continue to pursue this so we can start improving our survivability rates.
And as we look out 2-3 years, you know, as this is continuing to evolve within the military, the use of blood pre-hospital, both whole blood and pushing it further out to the point of injury, what does it look like? What's the future state look like?
Future state is going to continue, I think, really to be an emphasis on whole blood, particularly fresh whole blood, and making sure that every soldier, sailor, airman, Marine knows how to do a walking blood bank. We know that we aren't going to be able to necessarily have enough fresh whole blood to go around. So we need to really start pushing and looking at freeze-dried plasma or synthetic whole blood so that we can do large-scale deployments to get it pushed as far forward as we need to. We know time matters in helping decrease mortality, so we need to get them the tools that do that.